Okay. Well, thank you everyone so much for coming. Happy New Year. So in the last few weeks since our first webinar, there have been a lot of changes in the vaccine landscape, as well as at Keck Medicine of USC in terms of vaccinating our staff. So to explain those changes and kind of talk a little bit about what's to come, we have welcomed back Dr. Neha Nanda, Medical Director of Infection Prevention and Antimicrobial Stewardship with Keck Medicine of USC, as well as Krist Azizian, Chief Pharmacy Officer, Keck Medicine of USC. Dr. Nanda, Krist, thank you again so much for being here. So why don't we start out, Dr. Nanda, maybe you can tell us a little bit about what the global landscape of COVID vaccinations looks like right now.
Thank you, Mary, for having us, Mary and team for organizing this, because I think it's so important to keep sharing information as it's coming in real time. So with the vaccines today, we have, if we look at it globally, we have around 60 vaccines. It's exactly 64 vaccines that are undergoing human clinical trials. Now, in different parts of the world, there are different vaccines. In the US, we have Pfizer and Moderna at this time that have received EUA. In the UK, there's AstraZeneca, Moderna, and Pfizer. AstraZeneca, as you know, doesn't have the demanding cold chain requirements that Pfizer and Moderna have. Now, in the developing world, that's places like India and China, they have AstraZeneca, and they also have vaccines from their local groups, which have received authorizations, for example, in China and in India. So I'll focus a little bit on what the evidence behind the vaccines that we have in our country today. That's Pfizer and Moderna. Both are based on the mRNA technology. And what we know about the Pfizer vaccine is that it was designed to test for its efficacy after 2 doses. And the efficacy was 95%, which is amazing. For Moderna vaccine, again, it was designed to measure efficacy after 2 doses. The efficacy is around 94%, which is amazing. Neither of the trials were designed to measure efficacy of a single dose. And the way these trials are designed and the way we interpret results, that results in policy, are you decide the endpoint a priori. So a priori, it was decided that we are going to measure the efficacy after 2 doses. Therefore, we will stick to the schedule that was decided on in the trial and has since then been endorsed by FDA under EUA and CDC. We continue to believe that at this time, 2 doses of both vaccines will be needed. Krist will talk about what we have locally available. So that's efficacy. It's very efficacious after 2 doses. It's understandable the discussions that are ongoing about can we use half the dose? Can we use 1 dose? Very reasonable given what's happening. Having said that, the science is solidly grounded in what I just shared with you. I'll just, Mary, add one piece about safety of the vaccine. Both these vaccines are very safe. I will say that they are a little more, I shouldn't say immunogenic, they have a higher predilection for causing anaphylaxis than the previous vaccines that we have worked with. So typically your rate of anaphylaxis is 1 in a million. And with these vaccines, thus far, it's 1 in 100,000. With that, there are contraindications and groups where we have to take precautions when we administer the second dose or the first dose. And all those have been shared by CDC and have been embraced by all academic medical centers and definitely ours. With that, I'll stop, Mary, and I'll have Krist or you chime in.
Yes, Krist, why don't we localize that a bit? That was very helpful, Dr. Nanda. Thank you. Krist, why don't you tell us a little bit about what we are offering in terms of vaccines here at Keck Medical Center?
Sure. Good afternoon, and thanks for having me here again. So at Keck Medical Center and Keck Medicine, we currently only have access to the Pfizer vaccine. Essentially, the Moderna vaccine is being distributed to or allocated for first responders and long-term care facilities or certain acute care facilities that have skilled nursing facilities or long-term care facilities. So we've been getting allocation, a continuous allocation of our Pfizer vaccine as we continue to vaccinate our folks.
On that topic, do you mind providing a status update as to where we are in terms of vaccinating Keck Medicine healthcare workers?
Sure. To date, we've vaccinated 4,500 plus of our healthcare providers and staff members. We continue to work through the different tiers of our phase 1A, basically, in collaboration with our LA Department of Public Health and county partners. We are exploring opportunities with them to see if we can open up vaccination to our community providers that fall within the phase 1A categories in order to help expedite some of the vaccinations. We've also expanded to some of our frontline medical students and healthcare providers outside of the hospital, so our dental providers within USC, et cetera. And we'll be opening some slots up for them to vaccinate as they fall in to the phase 1A category. And then lastly, we are starting to plan for phase 1B, again, and vaccinating some of our patients that would fit in to the phase 1B category. And again, working closely with our county and LA Department of Public Health on when that could be made possible.
Great. Dr. Nanda, why don't we talk a little bit as we've sort of expanded vaccinating our healthcare workers to a wider group of healthcare workers. How did we go about prioritizing who would receive the vaccine and when?
So we started working on the process of creating phases within phase 1A very early on. And we've made all efforts to follow various organizations, starting with National Academy of Sciences, WHO, CDC, and then state authorities. That's our California DPH. And some of the common themes across all the frameworks have been that we want to reduce mortality and morbidity at an individual level, and also be sensitive to the fact that equity is what we live by. Keeping that in mind, all along, then we had to create our own framework because within phase 1A, we have categories, category A, B, C. And the way we created those categories is by prioritizing any personnel who is patient-facing, whether it's a physician, whether it's a person who is who's administering medications, or it's someone who's just going to check in the room for facilities. Anybody who's patient-facing receives priority, and then depending on your patient-facing time, the categorization is created.
And once we have vaccinated a critical amount of staff, is that going to change the hospital's infection prevention protocols at all?
So at this time, it is not going to change, because what's grounded in science is that it prevents clinical disease. Likely helps with transmission, but we do not know that. Therefore, if today I get exposed, I have to follow all exposure protocols. We have to continue abiding by our masking, physical distancing, following our PPE protocols that we worked so hard on in the last 10 months, including the screening protocols that we undergo when we enter the hospital. Nothing's going to change for now or in the near future.
So, on a related note, right now we're working through dosing people with the first dose of a two-dose vaccination. What happens if somebody were to catch COVID-19 in between their first and second dose?
So this is a very good question, and it's come up again and again. So I think it's an opportune time to address it here. If someone develops COVID infection within dose 1 and dose 2, that person can present in 2 ways. If you're asymptomatic, then for the sake of preventing transmission of disease, we are recommending that you get your vaccination 10 days after your diagnosis, as long as you've been asymptomatic, because we don't want you to spread disease. You should just be quarantined. You should be self-isolating at that time in your home. If you are symptomatic, we are still expecting the person to follow self-isolation, and the person will receive a vaccination, receive the COVID vaccination dose 2 after 10 days have lapsed and the person is symptom free for 24 hours. At that time, the person can, whatever comes later, can receive the vaccination.
Okay. So, a question for both of you. We kind of touched on this a little bit, but what can you tell us about our eventual transition to vaccinating patients?
Do you want me?
If you want to start?
I was doing all the talking, so I thought, but okay.
Oh, okay.
All I'll say is I'll reiterate what I said, that currently we are in phase 1A, and as we move towards vaccinating our patients, that's going to be phase 1B, where we know the priority is going to be given to essential workers and people who are older than 75 years of age. And Krist, please, I know you have a lot to share on this.
Yeah, I'll just add a little more to that. I think we're also working with our LA County partners there are patients that would technically fall into phase 1A as community providers, et cetera, that we would move forward with vaccinating as part of the initial phase. But for phase 1B, which is essentially 75 and older and other essential workers, we are planning for it. We are optimistic, hopefully, that we will get to them sometime in the first quarter of this year. But we don't have a crystal ball, and so I think what we can be is optimistic that we have enough ample supply coming our way, and there's been nothing to suggest otherwise. And we are planning to make sure we can we have the resources and the appropriate spacing to run a vaccine clinic in anticipation of phase 1B.
And are there any groups within the larger community that we should be a little bit more cautious or careful about vaccinating at this time?
So the only reason we are being cautious about certain groups is because those were the groups that were excluded from the big clinical trials that have been done. And with those groups, I'll preface before I go into what those groups are by saying, it's not that they can't receive it. We are just asking them to check with their specialist before they receive it. So for instance, someone who is pregnant, someone who's lactating, someone who's received a stem cell transplant, someone who's received a solid organ transplant, it's the timing piece that has to be taken into account, which the oncologist or the hematologist or the obstetrician would know best. So this is the group that we want to be able to vaccinate when it comes to our patients or employees, and we just want to be a little cautious.
Okay. And so I guess on a related note, let's talk a little bit about some of the vaccine side effects that people might anticipate. Can you walk us through what those are? And then at what point might somebody want to speak to their doctor because it's possibly something that needs medical attention?
The common side effects are typically really a sore arm. About 80% of the people did get a sore arm. A lot of my peers and myself did too. In addition, feeling fatigued, drained, this seems to be very common. About 20% of the people, which actually seems to replicate what we saw in the trials, do get a fever, not very high, about 100 degrees. And the side effects are pretty comparable, whether you look at the Pfizer vaccine and Moderna. And here we're just talking about these vaccines. As Chris said, we have the Pfizer vaccine here. So these are the common side effects that we've been seeing after the vaccination. The times that I would expect the physician would contact us, the patient would contact us is when there's shortness of breath, when there's a severe reaction, when there's angioedema, when there is something that just doesn't feel right, something that hasn't been shared with you in the fact sheet that's shared with you when you sign up for the vaccination. That's when you want to reach out to your primary care provider.
Okay. So as we look ahead to vaccine distribution to the wider community, I know that there's a lot of concern in terms of access and whether or not that access will be equitable across all communities locally and nationwide. So how do we ensure that vulnerable communities aren't left out of vaccine distribution?
What I can tell you is that things that are under our control, at our facility, we are going to make all efforts to live by our framework. At a federal level and a state level, there have been conversations about targeting the socially vulnerable groups. So there's an index, a socially vulnerable index, which where the index is higher, that means that area, those communities are more prone to be hit by a disaster like a pandemic. There are considerations of making sure in the community those groups have easy access to, by way of standing up pharmacies, by way of creating community clinics, so that those groups get access to the vaccine.
Great.
Chris, would you like to add anything to our framework and our operational piece?
No, Dr. Nanda, I think you said it well. I think it really comes down to making sure there's appropriate resources and setting up there's funding for appropriate setup of infrastructure in those areas to provide ease of access.
Great. So I think at this point, thank you both so much. This has been very enlightening. We can open up the floor to questions. So if any of the people attending the webinar or the press briefing rather would like to just submit a question through the Q&A feature at the bottom of our screen, feel free to do so. We will try our best to get through all the questions that have been submitted. If we are unable to do that, we will also do our best to follow up. And if anybody who is a member of the media would like any assets or help with any follow-up questions following this webinar, there is a list of our media team's contact information at the Keck Medicine newsroom online. You can visit news.keckmedicine.org and pull up that list, and we are always more than happy to help. So I do think we have some questions coming through.
Yeah, so this first one is kind of two-pronged. So I'll start with the first, is how is the health system tackling vaccine hesitancy among staff?
Yeah, I think maybe I'll start and Dr. Nanda can chime in. So we are in the process of really gathering data to drill down on our various units. Our initial survey had indicated, based on, I believe, 2,600 responses, that about 80% of our staff were very interested in getting the vaccine. What we are seeing now is possibly that about it's kind of declined to 70%. And so we are doing a drill down by unit to do some focused targeted education to those specific areas that do have some concerns and hesitancy in order to see if that can move the needle a little bit.
Okay.
I think
Dr. Nanda,
the only thing I'll add is that we've made all efforts to be consistent with our messaging. Understanding that with this pandemic, one thing that's been, it's funny, it has been constant, is that things keep changing. And We want to be ahead of the curve in terms of messaging. That's where we have been as proactive as we can to share the new data and the evolving data, and that is reflected in our policies around vaccination.
Very good. So the second part of that question is, will the vaccine protect against the new variant of COVID that's now circulating in the United States?
So, Chris, I can take that. What we know today, that the immune response that our body mounts following a natural infection or after vaccination, it will be able to tackle the new variant. That's what we know today. So this variant is, it's not something that we will have to succumb to if we have taken the vaccine and our body mounts the appropriate response.
Okay, that makes sense. Another question, can you comment on vaccination for patients that have had previous anaphylaxis that's not related to a vaccine?
Chris, do you want me to go ahead?
Yes, please.
Yeah, okay. So they're different, so I'll break it up. It's almost rehearsed. I think we've said this because everybody has this question and it's a very important question. So anaphylaxis to to COVID-19 vaccine or to an ingredient in the vaccine requires the person to consult with their allergist/immunologist before they plan for the second dose. If the person has had an anaphylactic reaction to a vaccine in the past or to an injectable medication in the past, we will counsel them. We encourage them to touch base with their allergist, and they will be monitored for 30 minutes after the vaccine, opposed to 15 minutes, which is routine. The third category is when someone has had an anaphylactic reaction to pet dander, to a food product or something else. At this time, based on the data that's accumulating, that group is not considered as high risk for developing anaphylactic reaction or a severe allergic reaction to the COVID vaccine. So that group can take the vaccine as of this hour.
I think we have about time for 2 more questions. Just
okay.
let the group know.
Let's see. Can you discuss how many vaccines have been received versus how many have been administered?
Chris, do you want to take that one?
Sure. So as we've administered just about 4,500 doses, plus more than 4,500 doses. We've received likely around 8,000 doses, and that includes doses that are reserved for our second round, basically, which will start on January 7th.
Okay.
And the last one.
And just one point of clarification: we have basically not yet given any second doses to anyone, just in case you missed the January 7th.
Thank you.
Okay, last one. If someone has been infected with the virus in the last 3 months and they display antibodies, is their place in line for the vaccine impacted? And does that move them to a different priority group?
Someone who has been infected in the past, that's in the last 90 days. If there is enough vaccination at an individual level, we will likely not be harming the person if he takes the vaccine. However, if the supply is not generous, and it's advisable to be a global citizen, like we all are citizens, in that case, this is a group that can delay their vaccination for at least 3 months, if not longer, And the reason for that is we know that reinfection is extremely uncommon following natural infection in the next 3 to 6 months. Therefore, that group can wait at this time.
Great. Well, thank you both again so much for all of this information and keeping us updated. So for those who have asked a question and were unable to get it answered, we will be following up with you. And again, if anybody has any follow-up questions or needs, the newsroom site is news.keckmedicine.org. But thank you, Dr. Nanda and Krist, for being with us today.
Thank you, Mary. Always a pleasure.
Of course.